Well, we're here today with Dr. Sam Pejham, if I pronounce that right, from Northern California, San Ramon and Pleasanton, I guess it's where you have a couple of offices where you treat children. So you're a pediatrician. Is that correct?
That's right. Yes, that's correct.
Well, Dr. Pejham, or as you say, people call you by Sam, Dr. Sam. Well, it's easier for me too. I can see why. Tell me a little bit about the philosophy of your practice, even though as patients or as, laymen here, we kind of, on one hand, we think a doctor is a doctor is a doctor, especially in a specific field, an orthopedic surgeon or a children doctor like you. But at the same time, we kind of have that feeling, no, they're all a little different. And it's a very personal thing, the healthcare, thanks God. So we do want to be a little bit, see that we chive with the doctor. Give us a little background of your practice, of what you do, and the type of patients which come to you, why. And maybe, Dr. Pejham, maybe you tell us how you became a children doctor. What kind of prompted you to do that?
Yes, well, first of all, thank you for having me. I was always interested in interacting with children, and of course I have a love for medicine, so for me it was an obvious choice to put my two passions together to become a pediatrician. And it's been an extremely rewarding experience from the very beginning. We're very privileged to be a part of the growth and development of our patients, and seeing them to go to college and all that is just absolutely rewarding. So what makes our practice a little more unique is that, of course, we have privileges at the local hospital. So we really meet our patients, our parents, to be even before they give birth. They come to our office for a free consultation. We meet and greet them, talk about our philosophy, what to expect. So really get to know them even before they become our patients. And of course, once the baby is born, we start from a very hospital ground that the baby is born in, and follow them continuously until hopefully we send them to college. So that's what we're here for. And we kind of try to provide that personalized service. And by doing that, we're available after hours, Saturdays, Sundays, holidays. We really try to spend the time with patients that they need and not try to rush them out. So we've kept our schedule as such to allow our patients to ask all the questions they have and not to be rushed, which I think it's most of our parents really appreciate it.
It's a big problem these days, due to insurance reimbursements being very low, and it's just the whole world apparently goes towards a little bit more mass production. And while that has its advantages, especially in healthcare, it's a patient wants to talk, or in this case, a mom wants to talk about her little girl's illness. She wants to explain it, even though you might get it within minutes, within seconds even, what's going on. But mom isn't satisfied if she doesn't talk about it, about all the little things the girl doesn't do and what happened to her. So I can see that this is important, very important. And also, I guess, the connections to the hospital, because if there is something which is out of the range of a private clinic, there is no big, it's like you're there. And the hospital knows you, they work with you, you're part of them also. So you have your small enterprise, and yet you're part of the big enterprise. And so thus all the machinery and everything is instantaneously available. So the patient really enrolls in both right away. I think that's good. Now, I also heard that you do things which other pediatricians don't necessarily always do, which is, I think you're big in allergy. Tell us about it.
That's right. One of the unique things about our practice is that we have special interest in allergy and asthma. So what we've provided, actually one of the very few practices in Northern California that even provides this service, is shot-free allergy treatments, which pediatric patients truly appreciate not having to get allergy shots. In our area, allergy and asthma is pretty significant, affecting a large portion of the pediatric population. So a lot of those children would benefit from getting allergy shots so they don't have to take as much medication. It's kind of a natural way for them to overcome their allergies and hopefully get a cure to their asthma. And so we do offer that in the office, and it's an oral way of desensitization rather than getting allergy shots. I also work with UCSF to do some clinical work on asthma, as well as I've produced this iPhone application, which about 50,000 people are using. It's a free application for those who suffer from asthma to better control and track their asthma. So it's more of a passion of mine. I have some family members with asthma, and it's been my passion to try to help those patients.
Wow, most doctors are known to be not even able to set up their cell phone or their computer or to open it. They need their receptionist to do that. And here you are developing an app for the iPhone. Unbelievable.
Yes, there's an app for that.
Well, we're going to talk a little more about that, on how people could use that and how it will help in more detail, but not right now. So wonderful. So basically, you are actually in contact or sometimes or often with the mom before she has the baby, and then as even though another gynecologist is probably involved also to get her through these times, but then you come in right there, and all the way up to college you kind of do all the things, whatever is needed for that child. And one of the extra things is the asthma handling, because you need to be really very specialized for that, and in order to manage it. So basically you have a certain things under one roof. Well, thank you very much. And by the way, where are your two practices exactly? Kind of like, not exactly, but more or less in San Ramon and Pleasanton. Anything you need to know about?
We're located at hospital ground, Valley Care Medical Center hospital ground at Pleasanton, California, and again, San Ramon Regional Medical Center hospital ground in San Ramon. And the reason we chose to be close to the hospital is just to have access to all the facilities that the hospital offers, as well as obviously multiple specialists within the same building. So we call ourselves a one-stop shop. When parents come to see us, if we need to do anything, get an X-ray, lab results and whatnot, everything is done within the same visit, and they don't really have to drive around for getting those things, which again, parents appreciate.
Right. And one of the reasons you can offer so flexible hours also is that it is not just you, but you do have other associates with there. So yes, so number one, some of them might know a different area of illness a little more than other ones, and can cover different hours, and yet the patient is still personally served. At the same token, while he has this advantage of having a few doctors there, it's not like in a hospital where every time you walk in you don't know the face anymore, because it's definitely somebody different, right?
We're a small group practice, and that way we all get to know our patients really well to provide them that specialized service. So we kind of know a lot of them by first name basis, and we see them around, and we all live in the same community, and we run into our patients out in the mall and out in the streets. So it's just a great experience to be part of the community and take care of the kids of our community.
Thank you very much, Dr. Pejham. Thank you very much.
Thanks for having me.